So, a very good afternoon, dear colleagues, and welcome to the session that we have organized, the European Center for Disease Prevention and Control, on the exploration of different futures in an uncertain world. And we want to explore the role of strategic foresight in public health. We have already, more than 10 years ago, looked into what will the infectious disease threats look like at the end of the decade, so in 2020. But at that time, we looked only at the drivers and their impact on infectious diseases. Now what we have been doing is a much more longer view into the future. We have done a more systematic analysis and came up with scenarios that we would like to discuss with you today. Because we have different drivers that we all recognize: climate change, globalization, economic crisis, geopolitical shifts, urbanization, inequalities, technological developments. And so what the effect of all these drivers is that the world around us is getting more complex and more volatile. So there is a need to be more anticipatory and explore what could be possible scenarios to prepare for the unknown. Now, what we have learned during the pandemic was that we, as actors in the health systems, need to look more widely outside our fences to other sectors and to know better what could be the future threats to the health systems and to prepare for them. But it's also very clear that we have seen how health impacts other sectors. And I think the bottom line of this is that we have to work together. I mean, there is no way that there is one sector that can prepare and the rest, well, we don't care. No, we have to do this together. So therefore, we have to prepare for unknown threats and ensure that that we are alert and capture any developments that may change any of these futures. So this is why we have set up such a program, a foresight program, with long-term scenarios of different possible futures. And that's maybe also unusual to use the plural of future, because there might be more than one possibility that is in store for us. And my colleague, Herjon Iking, will describe these scenarios and our program a bit more in detail shortly. So in this afternoon session, we will explore 5 of such scenarios, and you will be split up in groups. Since the room has been conveniently cut up in quadrants, and most of the people sitting in the foremost quadrants, some of you will have to go to the back afterwards. So the outcomes of these discussions will then, in the breakout sessions, will be jointly considered during the last half hour of our session. And we have 5 speakers. 4 of them are here. 1 of them is online. And we will look at what does foresight mean in general for national institutions, for EU institutions, international institutions, and for NGOs. So I really hope we have lively discussions. As just mentioned, we will have 5 speakers, and I would like to introduce them briefly to you. So first you will hear Dr. Aaron Rosa from the Fraunhofer Institute for Systems and Innovation Research. He will give an introduction to the general concept of strategic foresight and to how organizations can integrate foresight into their planning processes. Then my colleague Geryon Iking will present ECDC's foresight program and how we got to the scenarios and what the next steps would be. And then he will explain very briefly these 5 scenarios for the breakout sessions. So then we have the breakout sessions, and after them we have a very short, and I really ask you to come in very promptly, a short break. And listen to our third speaker, Dr. Henk Hilterink from the Dutch National Institute for Public Health and the Environment, RIVM, who will talk about the impact of strategic foresight from the perspective of a national institute. Margot Mattis from the Epidemic and Pandemic Preparedness and Prevention Department within the WHO Health Emergency Program will then present the outcomes of WHO program, program and the next steps for them in this process. And then we have Dr. Maria Guevara from Doctors Without Borders, MSF, who will talk about her experiences of strategic foresight and how this has been integrated into the strategic planning, preparedness planning, and fieldwork of this NGO. So all speakers will then be welcomed again to discuss the results of the discussions of the breakout sessions and to respond to any questions from you and your reflections after the discussions. So I will not have, we will not have a discussion after each presentation, but I will make room at the end so that we can discuss your questions, and please keep them for this time. For this to be possible, I will, and the speaker know this, I will monitor very closely that they keep to their assigned time. Please also keep your mobile phones ready. You will need to use them in the breakout sessions. And with this, I would like to give the floor now to Dr. Aaron Rosa for his presentation. Please.
Good afternoon, everybody. Let's see if this works. Oh, yes, works well. So my name is Aaron Rosa. I work at the Fraunhofer Institute for Systems and Innovation Research in the Competence Center of Foresight. And we do lots of foresight for lots of different projects, and it's my unenviable task today to try to sum up this process, these methods, and how it can be useful to learn how to use the future for all of you in 7 minutes or less. But before I go into the future, I would like to spend just a few seconds of my time to acknowledge the recent past and the sacrifices that have been made by many in this room, out there online, and maybe those people that you guys represent in professional healthcare workforce and all that it takes to support them. So thank you very much for everything that you've given and sacrificed during that time. I think that the past shapes the way that we conceive of the future and the futures, as Andrea has already stated. So before we dive into the process, let's think about a little, let me talk a little bit about where this emerges. It's a relatively recent field of study. First, around the birth of the modern era, governments and defense ministries particularly started using big data from a 1920s perspective to really start to look quantitatively about how can they look towards the future and with some level of clarity begin to make forecasts about what this policy or this level of funding would do. Very quickly, they came into kind of the limitations of this approach, of a purely quantitative approach. And they started reaching out towards multidisciplinary academic fields. And they realized, part of the reason that our quantitative forecasts don't always work, especially in the longer term, is that they cannot accommodate complex systems so well, particularly the emergence of new phenomenon that data sets can't account for. So complexity and other interdisciplinary kind of social sciences, economic sciences start to feed into how quantitative forecasts are built, and then more importantly, how they might be translated or communicated. One of the more interesting kind of things that emerges from the early years, I would say, of strategic foresight is the use of scenarios. The Rand Corporation, which was very large into quantitative forecasts, turned to scenarios quite early, and some people think that they might have invented this mode of communication of scenarios when thinking through the consequences of thermonuclear war, right? Yes, we have the data and the numbers that say this would happen if this, and this happened, if these missiles launched, but a scenario, a story, gave those numbers a life, gave them a meaning and a significance that was much easier for either non-mathematicians or for people from other interests to latch onto and say, okay, this is terrible, and of course, yeah. So, don't want to talk too much more about thermonuclear war. Scenarios and their utility was quickly caught on and utilized by corporations and organizations of all different flavors. Maybe more infamously here, the Shell Corporation used scenarios to weather and even exceed during the oil crisis of the early 70s. And their success in that context really planted strategic foresight as a useful tool for any organization to engage in. Now, all three of these kind of use cases of strategic foresight or future studies are still very active, and they're exchanging within one another. Quantitative methods continue to advance. Future studies continues to add different perspectives on both the quantitative and the qualitative side of future studies, and its use in corporations and other organizations that I think you'll hear more about today continues to inform the field in general. Okay, really quickly. Strategic foresight, as defined by the European Commission, this is from 2020 and it's still active today on their website. Importantly here, strategic foresight is not about predicting the future. This comes out of that academic approach, right, of saying we can't say what the future will be, but we can explore multiple possible futures. And when we explore multiple possible futures, what we're able to do is start to indicate what we do and do not like about different possible futures and figure out how we can take active steps today to guide and influence and shape the future that we want. So, very quickly, 2, 3, 4, 5. Okay, yeah, we're here in the present, and we're looking down towards the future. We are informed by our past. This is both individually and probably organizationally, but that's still kind of under wraps. All right, got to speed it up now. The past gives us two things: experience and knowledge, in which we shape a lens to look towards the future. We tend to make a projected future using that, and the practice of strategic foresight aims to broaden or expand that scope, that view of what is actually plausible, what is possible, because what we want to arrive at is what do we think is a preferable vision of the future that we should be working towards. Oftentimes during this process, we also encounter what's termed the preposterous, the idea that could never happen in the future, but sometimes it does. So you may have heard of wildcards or black swan events. That would fall under this. And those come out during the process of engaging with this idea of expanding our scope, our view of the future. There's a few ways to do this. Here's one way of looking at the cycle of strategic foresight. One goal that I have as a professionally is to try to institutionalize this process within an organization. So when we come in and we work through this cycle with a group or a client, we want them to understand each of these phases so that they can begin doing it themselves. And sometimes they already are. Here's some methods. When you're identifying change, you may have heard of these methods: horizon scanning, identifying weak signals, identifying drivers of change. That is, at the beginning, how we begin to expand the scope of possibility. Once we've identified what's driving change in the world, we begin interpreting it, understanding what is the scope of uncertainty around these drivers, and then we begin to kind of wrap each of those topics and their scope of change. Bam! Yes. All right. Into something scenarios. Again, these narratives that allow us to communicate very complex, really worlds. Yeah. Okay. Very good. Very good. One more click. One more. I'm going to try it now. No. Scenarios. So any way that we can inform or communicate all of the complexity of topics that are changing the world and how they can affect the long-term vision. Scenarios are one very prevalent way that we do that. And then the most important and probably the most difficult, where the rubber hits the road, as they like to say, is using the scenarios and what we've learned through this process to begin shifting strategies and operations inside an organization. And then lastly, making sure or hoping, facilitating that this process, this cycle, becomes embedded in the organization itself, because you can do this once and gain a lot from it, but actually it's going through these different phases of the cycle, learning together as an organization. Thank you very much for your time.
All the speakers are aware that they can still, what they cannot say now, have an opportunity in the end when you ask the questions, they can still say that. So it's not that I try to deprive you of anything worthy that they want to say. Please, next one is Herjan Iking from the ECDC program and how we came to our scenarios. And he will describe also the scenarios. Sorry for that.
Thank you. Yes, so like Andrea just mentioned, ECDC is setting up a strategic foresight program, and the main aim of that is that we try to help European public health systems, including ECDC, to become more prepared and more resilient to future health threats. So, of course, preparedness and prevention has been a focus of ECDC and other actors in the European health system since the foundation, but we are increasingly facing interconnected challenges and accelerating changes. So we cannot assume that the future will be anything like the past or the present. And that means that if we want to still protect European citizens from infectious disease in 20 years' time, we actually have to adapt to the changing realities that come with these uncertainties, anticipating problems so they don't become crises in the future. But many of these necessary adaptations, they have a very long lead time. So think about, setting up new data infrastructures or setting up new collaborative networks with new disciplines or new geographical areas, or reskilling of the workforce. So that means that if we want to be ready then, we already have to start working on that now. And that's where foresight can come in, and that's also one of the objectives of the foresight program. So besides using the tool of future scenarios, we will also have some other objectives in the foresight program I want to highlight. Considering that realities keep changing and therefore also the possible futures keep changing, foresight cannot be a one-off study. It has to be a continuous process. So we are exploring horizon scanning methods to, continuously scan for threats and opportunities in the future, signals of change that are coming our way, make sense of what the possibilities will be for public health, and then also proactively act upon them with our partners in other One Health areas. And at the same time, we'll have to be setting up foresight, public health foresight capacity building, both in ECDC and our member states. So that's also a very important part of the foresight program, the next step. But to make it a little bit more concrete so that foresight doesn't stay all abstract, let's go to the exercise. And in today's strategic foresight exercise, it's a brief one, we'll be doing future scenarios exploration. So how did we get to these scenarios? So we started by considering what are important global trends that we're already seeing today and are likely to continue like that in the future. So think about, for example, climate change, think about demographic imbalances, about urbanization, hyperconnectivity, and things like that. Then, what are the underlying drivers of change that are most relevant to public health systems in Europe, especially dealing with infectious diseases? Then moving to 2040, how would these drivers most likely develop? So what is the most dominant pathway they're likely to take, but also what are alternative pathways they may take in the future that we should take into account? And yeah, so determined by a very large and diverse group of experts, both within and outside of ECDC, these were considered the most important drivers of change for European public health systems, which also bring a lot of uncertainties. And as you can see, except for the bottom one, antimicrobial resistance, none of them are actually directly related with infectious diseases. And you can also see they're very diverse, so they're covering inequalities, aging, climate, natural resources, geopolitics, and also ways of how we communicate and how we handle data. So although reflecting on how these future drivers and the different pathways they may take impact our operations and strategy is already very useful, you'll also probably appreciate that several of these are very linked to each other, they influence each other. So think, for example, about inequalities, climate change, and migration, very well connected with each other. So to consider these interactions between these different pathways of drivers more holistically, we have taken alternative pathways of connected driver sets and developed future scenarios. So that's where we ended up with the scenarios. And yep, there we go. So each scenario describes a world, how it may develop in 2040 if a certain set of connected drivers goes in a particular direction or another. Also shifts in governance and developments in technological developments have also informed these scenarios, by the way. Importantly, scenarios should not be seen as predictions. So they're really a tool to help explore different possible futures. So think of the future cone of possibilities that Aaron just presented to make these uncertainties more manageable and to prevent decision paralysis. Because in the end of the day, we should indeed make strategic decisions now about uncertain futures. Strategic foresight should be the start of an intervention. And that is also what we're doing today in the breakout groups. So how to address the infectious disease challenges of these futures. So moving back from 2040 to the present, what are steps and actions that we need to take now to prepare for these future scenarios in the future? Yeah, perfect. So we will be exploring four threat scenarios. Oops, one back. Yeah, four threat scenarios for 2040 in this room today, and one additional online. And I'll walk through them in a minute. But first, some important points. These scenarios are designed to be, in principle, non-normative. So meaning that none of these are preferred scenarios for us, but also none are dispreferred for us. But they are threat scenarios, so that means that they focus on the challenges, and they may seem a bit dystopian because of that. But also in each of these futures, there should still be opportunities that we can get out of it. And also, again, the futures, these scenarios are not predictions, so they shouldn't be seen as predictions. Probably none of these scenarios will be the future, the reality in 2040, but most probably, elements of each of these scenarios will be part of the reality in 2040. So again, it's a tool. Also realize that these scenarios were developed on more extreme ends of driver developments, but please be open-minded to them. Approach them as if you're visiting a foreign country. Things look different, things look wrong even, but still people live there and people, it exists. Also consider that what you may find preposterous, other people may find plausible. So, for example, many years ago, 15 years ago, many people thought a volcano eruption blocking all air traffic in Northern Hemisphere would be preposterous, or war in Europe, indeed, or a global pandemic. But still, here we are. So. You'll get a more detailed presentation from each of these scenarios that you'll be addressing in the breakout group later, but I'll just go very briefly through them to give you a taste of the diversity. So scenario 1, which will be done in that corner, will be led by Katie, is a united EU in a polycrisis world. So this world is defined by economic, environmental, social, and systemic crises. The EU draws closer to forge forward, but stands quite alone in the world. Then scenario 2, which is in this corner over here, urban dominion and digital society, will be done by Aaron. People find refuge in engineered safety of cities, where a global youth-driven high-tech culture thrives, but not all can keep up. Then scenario 3 will be in the corner over there with Daniel. It's public health in private hands. The private sector is dominating decisions, services, and data, with mainly privatized healthcare sector and market forces in control, but in whose behalf do they optimize? And then scenario 4 in that corner over here with me will be building back nature. Global movement with complex transformations to align human activities with planetary health is underway, but there are emerging challenges and the EU is more a follower than a leader. And then finally, for the online participants, they can go through the scenario Patchwork Society at their own pace. And the description is exhausted and intimidated by creeping governance. Many try to break free and create their own isolated utopias, but can so many diverse, self-organized communities thrive? And since there's no preferred scenario, please spread out, evenly. Move the chairs a little bit to the screens, let the mental time travel begin.
Yes, thank you very much. And please make sure that also the screens and the scenarios in the back are attended, and choose your scenario that you feel you would like to explore. And you have 25 minutes from now. You take your seats, please. Please.
I'll call everybody in.
Yes. So please take your seats. There will be more time for discussion, but only if it's cut now, because otherwise I have to shorten the time of discussion. And I think it would be good to have the opportunity to hear from the various groups. Because you had the discussions in your groups, but I think it's good to hear also what the other groups have been coming up with. So now Henk Hildering has the ungrateful task to start
They're coming.
while everybody is coming in. I'll give you an extra minute for that.
Maybe I don't need it. But it's nice if people can hear it as well.
Yeah.
Good afternoon, everybody. And thank you for this very good and nice invitation to be here. And it's very good as well to see foresight back on the agenda in Gastein. So thank you for that as well. I'm going to give a reflection from a national perspective. I work for the National Institute of Public Health and the Environment in the Netherlands. However, I'm also, RIVM is also the work package lead of the Population Health Information Research Infrastructure, where we have been doing on capacity building regarding foresight in public health. And we set up a whole training course on foresight for public health, so that is all available online. And actually last week we had our 3-year anniversary of the FiRe project. And one of the things was coming out of that as well to strengthen the capacity on foresight. And I think this is all helping for that. And RIVM was doing that already within the FiRe project. And that's because we have, let's see if we have at RIVM more than 30 years experience now in doing a public health foresight study. And it might look a long time, but it went with small steps, bigger steps. So I will take you a little bit through that experience that we have. It was commissioned normally by the Ministry of Health. However, we are very lucky in the Netherlands that we have a law that is applicable to RIVM that states that we have to report every 4 years on the future of public health in the Netherlands. And that's guaranteeing the future, but also guaranteeing independence as well. So that's very lucky that we have that one. And at the end, we are doing this for the Ministry of Health to support evidence-informed policy making. And of course, policy making is about the future, so you have to understand a little bit more how the future might look like, and foresight is a tool to gain those insights. And we're doing a strategic foresight. For us, that's also, we are looking very often 25 years ahead. For policymakers, that's far too far, because a political life is not 25 years normally. But it is very good first to get a little bit out of the here and now, but also to think of decisions taken now might have long-term implications as well. So having that awareness is also helping to take a longer time horizon. On the right, you see, by the way, the whole journey that we did with all the reports. And I'm going to highlight 3 aspects. That's one thing that was part of more or less all the reports, was that we have a very strong quantitative way of dealing with epidemiological indicators. And a number can say more than 100 words. We all know that. However, it becomes also stronger with a good story. And we have seen now the stories of the scenarios that really can help to strengthen the numbers. However, those numbers are really important to know what we're talking about, even about the future. But it needs as well the qualitative interpretation as well. Something that did change over the time is the increasing complexity. It was mentioned already. At first, in 1993, where we're dealing with a handful of diseases and risk factors, let's say the traditional ones, smoking, overweight. Gradually, that grew. We're doing now projections for more than 100 diseases and health conditions, and also 50, 60 risk factors, trying to address the wider determinants of health where we can. Of course, we are failing in some parts as well. For example, socioeconomic status is a very difficult one, but we're trying to deal with environmental issues, we're trying to deal with occupational issues. So that is something that already increased complexity. The second layer of complexity, it's no longer only about health, it's also about healthcare. And we knew that already, but the pandemic showed that the vulnerabilities in our healthcare also can have quite some repercussions on our health as well. And the third layer, of course, the pandemic showed as well that infectious diseases are back. We entered most likely a new era, epidemiological era of where we have an aging population with chronic diseases, multimorbidity, and at the same time we have the erratic pattern of possible outbreaks of infectious diseases, making it more complex. So I think it is nowadays no longer possible to look at these issues from a single perspective. That was number 2. Number 3, what I want to stress is, at first it was much more scientific exercise that we did, thinking there's something like the truth. However, having the involvement of stakeholders became more and more important. And let me show you, this graph was already shown before. Then you go, if I can, like the forecast, the most likely future. You can think of scenarios, but actually with public health we realize there's a lot more discussion going on what is actually a desirable future. There it is. So instead of not only focus on the scenarios, what can happen, it's also what kind of future do we want. And foresight can stimulate a discussion about that. I will go then to the lessons learned. This is a bit on the 30 years of experience that we have about doing the foresight study for the Ministry of Health. It's a different audience than ECDC is doing now, but maybe it helps as well. And first of all, policymakers and uncertainty. It's a rather difficult combination. they have a short-term focus and they're looking, of course, for certainty. However, after the 30 years, people are looking for robust policies, win-wins. They are very difficult to find. The silver bullets are not there. So, yes, we have to take certain decisions, and no, we cannot achieve everything that we want. The second point was also mentioned, no prediction. That's what we say all the time. And what do you see in the media? RIVM predicts, there we go again. However, it's very good to realize all the evidence, knowledge we have says something about the past and maybe the present, but not about the future. We don't have a guarantee for that. And all decisions are about the future. So we have to realize that we have to deal with uncertainty as well. The importance of stakeholder participation. The normative aspect that desirable future is important, and to facilitate that discussion, all the stakeholders have a stake. They have certain priorities, certain norms and values that they are striving for. And I think the foresight can really help to stimulate that discussion. The almost final point is that knowledge translation, what really works. And knowledge translation is not only that we think we do this and policymakers do something with this, it's also listening to policymakers, what do they need, what works for policymakers. So that is also the two-way of dealing with knowledge translation. And last but not least, that is something that we're trying to do or stimulate more and more, that we, instead of evidence-informed policymaking, it's about foresight-informed policymaking, where you do take the best evidence that is available, but you account for the uncertainties that you have to deal with. Thank you very much.
Very good. So thank you so much. And now we go online. And I hope Margot Mattis is available. Yes, I can see you. I hope you can hear us.
Yes, I can.
Very good. We hear and see you as well. So, Margot, you will explain us how WHO is dealing with foresight and what your next steps are. And I find a way to indicate to you when you're running out of time.
Great.
Okay,
perfect.
Thanks.
So I hope you can see my slides. I'm sharing. Yes, perfect. Great. So thank you for inviting WHO. I'm really glad to be here at the European Health Forum to talk about our initiative for improved pandemic preparedness that we launched in 2021 in the midst of the COVID-19 pandemic. And it's really great to see that more and more agencies are using foresight in their daily work to make informed decisions. So as you know, since the start of the 21st century, we have already faced many major epidemics and pandemics. And I have to say that the way we were dealing with these threats was quite reactive, meaning that after each big event, we are usually conducting a lesson learned exercise. And it's really critical to learn from the past, but sometimes it's not enough because the next major threat might be very different from the previous one. So this is why we decided to introduce foresight at WHO in the midst of the COVID-19 pandemic. And it was quite a big change because, you know, when you are responding emergency after emergency, your resources are quite stretched and tired. But at that time, it seemed really important for us to take the time to really step back and reflect and not just be responding in an emergency mode all the time. So, you know, foresight is not just having nice discussion about crazy scenarios, but it's really about being better prepared collectively to tackle the future threats. So in our exercise, we used as well scenario building, and you saw an example of this methodology today. But what I want to emphasize today is that it is really important at the start of your foresight exercise to select and agree on a time horizon for your exercise, because it will really determine the type of trends you'll take into consideration in your exercise. For instance, if you look at a larger time horizon, a larger number of trends would come into play. For instance, if you think about climate change, we can say that for sure it will have a major impact on infectious disease in 20 years' time, but maybe not so much if you look at 2 years' time. So in our case, we chose a time horizon of 3 to 5 years, just to make sure that our scenarios could be updated regularly, given the speed of change of the factors, and as well so that immediate action could be taken immediately. So we ended up with 4 scenarios, and for sake of time, I won't describe them here, but you have a link you can follow if you want more information about our scenarios. And I have to say that scenarios are really a quite powerful tool to trigger imagination and out-of-the-box thinking. And our experts really enjoyed the discussion around the scenarios, their implication, and what they could do individually, collectively, but also institutionally to get to what they identified as their preferred future. Sorry. And in terms of outcomes, we identified really 3 guiding principles that repeatedly emerged during our discussion, and that should be seen for us as the basis of any future pandemic preparedness. So it was trust, solidarity and equity, and sustainable development. And under these 3 pillars, we identified 5 themes and then tens of practical ways forward. And I have to say that the list of ways forward we have is not an exhaustive list, because it's really expert dependent. And in the limited time we had for the exercise, we couldn't invite all the expertise around the table. But this should really be seen, as an ongoing work, and the scenarios and the recommendation will be regularly updated. So in terms of next steps, there is a plan to regionalize the scenarios, because right now they were done at the global level, and to do also diving into specific themes. For instance, last year in consultation with many experts, we did a diving into the future of infectious disease surveillance. And again, if you want to have more information, you can just follow the links in the presentation. So in terms of key messages, I want to leave you with 2 important points for me. So first, it was that foresight methodologies are really a good way to build partnership ahead of crisis, because it's not during a crisis that you will build the partnership, and your response would be much more efficient if you have in advance built a partnership, if you have predefined roles and responsibility of each stakeholder. So when the crisis emerges, you can really take action immediately. And among all things, what was really striking for me was that foresight was an incredible way to connect with stakeholders beyond our traditional circles. And I have to say, this is not easy, and it usually puts us as public health practitioners, but also as human beings, out of our comfort zones, because we are used to talk to the same people in terms of expertise, in terms of geographical location, in terms of demographics. And so when you talk to the same people, to the same circles, you usually end up with the same problems and the same solution. So during our exercise, it was really important for us to read really to a broad range of expertise to really make sure that we will get new perspective and new ideas. So we reach out to the youth, to faith and community leaders, even to architects and artists, in addition to our usual health and scientific advisors. So it was for me really a requirement for success of this initiative, especially because pandemics require a holistic and whole of society approach. So on this, I thank you very much, and please don't hesitate to be in touch or to follow the links in the presentation if you'd like more information about our initiative. Thank you very much.
Margot, thank you so much. You have exactly kept to the allotted time. That's a major feature. So now we have our final speaker. That's Maria Guevara from MSF, and she will see tell us how such foresight can be integrated into the practical work of an NGO. Please, Maria.
Thank you. Good afternoon, all. It's always tough to be the last speaker, as it can be a blessing or a curse, but the great timekeeping is allowing me to actually be able to share my perspectives from the MSF experience, and thank you for the opportunity. So the question that was posed to me was, how could strategic foresight be useful to other NGOs from our experience? I believe it's the first question of why this is useful for NGOs, and arguably for all of us, as this will explain how strategic foresight can be useful and should be useful. So for MSF, as a medical humanitarian organization and emergency responder, our why is about saving lives, alleviating suffering, and promoting dignity as best as possible. And that means doing what we do better, being better prepared for emergencies, and therefore more lives saved. We do that, in fact, always have, through scenario planning and anticipation of what may happen. And our recurring mantras in our heads are usually, okay, always ready means always prepared, and we fail at that already. Early warning plus early action, because you cannot have early warning systems without the following actions. It is a must. And leaving no one behind, especially the most vulnerable. So in carrying out these emergency responses today, it's getting harder and harder. Our capacity to respond to medical humanitarian actions or emergencies is under constant stress test. And one of my key roles as MSF International Medical Secretary is to chair this medical operational platform, and we have all the medical directors and operational directors of our 6 operational centers globally. Each year, we look at our mutual accountability report and look at what we've done in the past year. And did we meet up to what we said we would do? What were our choices and what were that trade-offs? And how do we do this better? And did we deliver to the people that we said we would deliver to? So 2022 has proven incredibly challenging. And we saw 2020 and 2021 was already crazy. But in 2022, the volume of our emergency activities just doubled and tripled. So if you take our outpatient consultations, it went from 12 million to 16 million in 1 year. Malaria cases doubled from 1 year to the next, from 2 million to 4 million. Today, we also respond to cholera outbreak, and I know many of you may have heard that, which has not been in this scale for 30 years. And then today, even, we're treating diphtheria outbreak, which is a re-emerging infectious disease. It's burgeoning right now in West Africa, but we do see cases globally. And in those 2 cases, there's a lack of vaccines for cholera, and there's a lack of diphtheria antitoxin for treatment. So this is what you're facing today. So if you take all that, and you look at what happened, a lot of this outbreaks was in the wake of COVID, right? Where the routine epi-vaccination coverage failed miserably, and now we're seeing it constantly driving. But so this is what we do. We take the here and now. But what we're seeing tomorrow is incredible unknowns, right? We're looking at huge levels of uncertainty. And if our best tool today is our best practice and direct experience on the field, which we know is that growingly maybe not enough, then what do we have ahead of us? And what, with the scale, severity, and duration and frequency just going beyond borders, so to speak, this is where how strategic foresight is actually useful and fits in. In preparing for this talk, I actually looked at what strategic foresight, just to have the framing correct. And I read this article on lessons from the future, how to make robust strategy in times of deep uncertainty in the Harvard Business Review. And it said by J. Peter Skoblik, strategic foresight doesn't help us figure out what to think about the future. It helps us figure out how to think about it. I'm not going to go into the scenario planning because it was so well already explained, the different phases on it. But at MSF, we have been looking at strategic foresight. In the midst of COVID, actually in the summer of 2020, we collaborated with ICRC and the International Committee of Red Cross and the UN Humanitarian Refugee Commission in an exercise of signal and sense making. Yes, in the midst of COVID, but also because we were looking at what will COVID mean for the future. And we came up with 5 anticipated scenarios, which were disparity of access, amplifying the local in our work, rethinking response, a cry for leadership, and digital maelstrom. But today, after all that, which we projected, we still were unprepared for this last year. So today we're focusing on anticipation, not only anticipation, but also anticipatory action and how to translate these plausible scenarios into real-time action now. And we have a malaria anticipation project, for example. When you have such numbers as high as that, how do we put interlaid data over data, epi-data, with climate data, with environmental data? And what we're seeing is that is helping us to understand where these scenarios might happen, how big the scenarios might be, and therefore better prepared. What's coming out is the timing. There is a definite link to lead time on how you present, how you are able to respond. Also the degree of severity. But there is also what was really interesting is how we also identified the opportunities for alternative intervention. The idea, though, is very difficult to continue to implement everywhere when there's so many different priorities. And I guess what I'm saying here is it's only one impact that we're trying to do on anticipatory action. And this is only one way we are trying to bring predictions to actions in the real time, because for us, what we see already is that for many communities, the plausible future is now. It is already affecting them today, and increasingly making them vulnerable and leaving especially those left at the fringes of society. So the issue for me is in the what, is the role of the here and now in these imagined futures. How do we respond and take action now while keeping the future in view? So at the end, I have more questions than answers for you, but perhaps this questioning is the first step of strategic foresight. So thank you very much.
Thank you. Thank you so much, Maria. And Maria was the only one that followed our encouragement of no slides. So now it's time to hear from the groups. And we have some fantastic helpers in the Younger Steiner group. And I call now the rapporteurs of the single groups to the podium. So that is for scenario 1, Shinan Gattas. Scenario 2, Bianca Kukos. Scenario 3, Gabriela Gruber. And scenario 4, Manuela Pausan and Elodie Besnier for the online group. And each of them has 2 minutes to wrap up the fantastic discussions that you had, the rich interaction that you did, and I'm sure they're up to the challenge. Jinan, would you like to start?
Can you hear me? Yeah.
Yes.
Okay, so in the first scenario, we covered a united EU in a polycrisis world where we have a European autonomy and solidarity, but we're lacking global governance. So almost half of the participants thought that it is likely to have such a scenario. So on a scale from 1 to 5, the rating was a 4/5. Then the group estimated that national public health systems are not prepared for such a scenario. The most pressing public health challenges in this scenario were an increase in conflicts caused by tension between different global blocs, Inequalities, so an increase in inequalities. We have heat-related problems such as an increase in vector-borne diseases and other emerging diseases, mental health issues caused by living in a hostile world, and aging population. So in terms of what needs to change in the public health systems in Europe to face these challenges, what was discussed, we had many points that were discussed. Here's a summary of that. So health system preparedness and proactivity, so not just reacting to crisis. Then we have improving coordination and surveillance of vector-borne diseases, emerging diseases, and antimicrobial resistance between global blocs. Addressing social determinants of health to address inequalities, and then coordination and cooperation across different sectors, investment in sustainable communities within the EU, health education and prevention in order to empower citizens to be in charge of their own health, and dialogue between other global blocs, so in order to achieve a certain global solidarity and making sure that migrants are not left behind.
Thank you so much, the group. And if someone else from the group has additions to make, keep them. We put them into the general discussion afterwards. So please, Bianca.
Yes, so my group had to tackle the urban dominion and digital society, which was found to be a very likely scenario. There were some challenges identified. One of them is that digital isolation is possible, pushing people to use technology even when they feel comfortable. This might become a problem. Human interaction might face difficulties. A question that we have to ask ourselves is, who is digital literate to manage living in such a world? Another problem raised was the concentration in cities, which is very likely. It's already happening in many parts of the world, and we can already see many differences in responses to the digital transformation. Also, climate refugees might come to Europe because they might feel more secure here. An important point is that we need more solidarity and resources to help with the care of the elderly, which is something that we are not prepared for right now. And there are also positive aspects in this scenario. Digital transformation means more data that could inform policies, something that is desirable. As for the solutions, the main takeaway, I think, is that we need intergenerational solidarity and empathy. We need inclusiveness, a society open for technological innovations for all. Also, we need more transparent public health systems with information accessible to everyone, and we need to fight antimicrobial resistance, and of course, not forget to monitor the trends.
Thank you so much to you and all the participants of the Scenario 2 group. Gabriela.
Yeah, we were talking about public health in private hands. And we start our discussion with the comment, isn't this already happening? So we then discussed about possible threats or risks, and there was the main risk that the private sector may set priorities that were for short-term profits and not for the equal access of healthcare, so there might be the wrong priorities. So we also talked about that it is important that there is no increase of health and social inequalities in that scenario. So we went over to what to do in public health. So we said it must be now to establish ways of public-private partnerships that have a sort of framework where it is set rules for collaboration, for example, that conflicts of interest should be transparent and must be transparent and declared by the stakeholders, that it's also taken into account for cross-border collaborations because industries are acting globally, that it is important to set a joint agenda for these public-private partnerships, and that the state can set goals for innovation in this course, and also it is important to take into account that there is no increase of health and social inequalities.
Yes, for sure. And that was by far the most popular scenario so when I looked here in the room. So thank you so much to you, Gabriela, and the group. Now we come to group 4, and that is Manuela reporting.
Yes, so we had the building back nature and a shift from power from Europe to other regions that were more affected by climate change. The scenario was voted very unlikely to happen by 2040, although transformation will happen in that direction, but most probably the scenario will happen much later in the future. Currently, the public health systems are not prepared for such a scenario, and many challenges were actually identified between zoonosis, vectors, novel infections, also aging, lack of treatment, a move away from non-natural solutions, so that means that there will be less vaccine coverage within the population, and of course there will be a strong movement of people from affected areas to less affected areas. And also there will be potentially a budget move from really addressing health to more sustainability. So that's also something to be considered and addressed. And in solutions, we identified a few solutions. What suggested that we should move from a national to really a transnational, so integration of public health system, it's important. We should have a more global focus in mind. And we should really try to integrate sustainability with health already now, because we have to address both in parallel and not invest only in one and less in the other one. This is very important. And health systems should be adaptable and flexible, because the world is moving fast, and we have to make sure that we are addressing all the challenges that we are facing. And importantly, this has been brought over and over, we have to learn from the pandemics, but the other outbreaks as well, and we heard today in the presentation, to really be prepared for the next pandemic and make it in such a way that there will not be a pandemic, so we can quickly answer and stop it. And the last part is really monitoring already specific problems like vectors, but also zoonosis and other challenges that are coming.
Thank you so much to all who were in the group. And Elodie will now summarize what the online participants gave to their scenario.
So the online participant moved into a world where people had turned back towards their local communities, building stronger global networks of small communities, but also weakening national and European authorities. While the participants thought that was fairly unlikely to happen, they all agreed that our systems are currently very badly prepared to address such a situation, primarily because of the difficulty to address such a level of fragmentation, the mistrust in authorities that is already existing, and questions as to our capacity to really connect local communities that can be different and very diverse. And the main challenge that all our participants saw was inequalities and disparities in capacity, in resources, in access, as well as challenges in communication between those groups and between the institutions and the communities. The four main changes that our participants identified were, in the first place, strengthening the local level in capacity, in resources, and bringing support at the local level for local authorities. The second one was the decentralization of our systems. The third one was empowering our citizens and our communities in order to respond to those challenges. And finally, improving our communication in order to build the trust in our institutions and in our science. Thank you.
Thank you so much. And I think we could give a big round of applause to these reports. I haven't been listening to all of the discussions, but I get a good picture from these 2-minute reports what has happened there. Great compliment to all of you. Thank you so much. So, and now we can discuss what you have heard from the reports, reflections that you want to give to everybody here from your discussions, from what you heard from the others, from the presentation. I invite also the presenters. Also, I hope Margot is still, please, yeah, go to the podium. I hope Margot is still here. Yeah, she is. So you can also address questions to Margot, and Margot, I will come back to you in case you just raise or wave your hand if you want to come in here. So if you would like to say something, just wave your hand. Someone will come with a microphone to you. State your name and your affiliation, and then you can talk. Nick, here there is already one. Can we have a microphone, please, to Nick Fahy? 1 second. So,
Thank you to you, Andrea, and to the rest of your team.
Name and affiliation.
Sorry, Nick Fahey from the European bit of the RAND Corporation. Thank you very much for the plug earlier, Erin. Much appreciated. And thank you, Andrea, and your colleagues for organising this. I thought it was a fascinating session. We were very strong, and we do a lot of work in foresight, obviously. So this goes, I think this is a really great way of looking at these challenges, but. The big but with foresight, which I don't have a good answer to, and I'm really interested to see what the panelists have to say. The last pandemic, we had countries who had run foresight exercises and preparedness exercises before the last pandemic, and in some countries that shall remain nameless, like the UK, they had done that literally years, a few short years before the pandemic arrived, and had all foresight of what was coming, and we all saw what happened. So for me, the big challenge, the first step is foresight. The big question is the governance of what happens next. So we've tried tools like our Center for Gaming has tried to get policymakers to work through things through analytic games, but I would be fascinated, especially from, for example, the perspective of the RIVM in all of these years, how do we go from these understandings of the future to action now?
Yeah, thank you.
Thank you. I thought I saw it coming already. Yes, actually, when we were doing the update from the 2018 Foresight study, we thought, shall we mention again the pandemic? That's a threat for the future. And then, yes, we did. But, of course, there were so many signals already out there. I don't know if you saw the movie Contagion. Scripted completely the pandemic. So there were many signals, but we missed them. And I think foresight is also just a tool. So it's not like the silver bullet to be prepared for everything. Secondly, being prepared, we think all differently about it, what it means. So some people think more from the economic perspective. You can also look at it from the health inequality perspective. So thinking that we are prepared already now, I think we're not prepared for the next pandemic either. However, what you can do with foresight is to stretch your thinking about possible things that might happen and things that are not that mainstream, that you put them into the thinking about the future. It doesn't guarantee that we are going to be prepared either.
Yeah, any of yeah, please, Maria.
It's a great question. It's really hard to answer when you do not have the will to have global solidarity. And we discussed this in one of the session. And if we don't also take on the realization of cultural humility, can we put ourselves in this from the perspective of another? So when we're doing scenario planning, are we looking only from our lens, or should we be looking from another's lens? And then lastly, I think is one of the things we're learning more and more is how to actually work with the community. So the malaria anticipation project that I mentioned there was also a flood kind of preparation, because it was in South Sudan. So which means when we were trying to do malaria outbreaks or even hepatitis E vaccination, it was a near impossibility with floods. And we were, from the 2019 and since on, we've been working with the community because they were not having the alerts themselves. So when the flood hit in 2019-2020, we were surprised. What? We were prepared for this, but actually not. Our hospitals and our centers and our stocks were washed away, and we weren't ready for that. But then we started to work with the community to learn how to alert each other, and then actually got better prepared. But it's an iterative process of preparation. So it's about the will and really wish to do something globally as a solidarity, taking whatever access to products or whatever we have, really trying to make that happen and be able to be localized as far as production, as far as access, and seeing experiences and scenarios from another's perspective, and then just working with the community directly. Those are possibilities. Let's hope we can do it.
Yeah, Aaron and then Herion.
Really quickly, you mentioned about the kind of interface between governance and foresight, and I think that's one thing. In speaking, nameless countries and who dropped the ball, not having the stakeholders agree. Or not necessarily agree, but like be on board with an institution can do strategic foresight, but are they going to have the connections and communication lines available after to say to others that they would rely upon in decision-making times, we've done some foresight, we'd like you to look at it so that we can figure out a plan. If this happens, who's going to have the responsibility and decision-making power? And that's a hard conversation, especially when governance does have high turnover. They tend to be myopic or, given these other things. But that is an interface that's really critical. Okay,
Herion and then Claudia here.
Yeah.
First here, Claudia. Here, you have to wave, Claudia, because otherwise, yeah, please.
All right, I'll answer very quickly. So about the preparedness to pandemics, yes. So a lot of preparedness indexes showed that several countries were, very ready, but those were assessed from a very particular public health angle and a public health crowd. And I think what we worldwide underestimated is, for example, the impact of political decisions, of geopolitical struggles, of misinformation and disinformation. And I think that swallowed up a lot of resources from public health bodies, and then they were not able to cope anymore. And the other thing was exceptionalism, because I think many countries thought, we are so prepared, this will never happen to us, right? This is a foreign problem. And then it came. So I think foresight can help bringing these perspectives into the mix. Like you saw these scenarios we discussed today. Geopolitics were discussed, and I think in the preparedness plans before, this was not really taken into account very much.
Yeah, thank you. Claudia?
Yeah, thank you very much. I'm Claudia Havel from the Austrian Public Health Institute. And what I was wondering, listening now to all this debate on foresighting, only Maria mentioned communities and perhaps citizen engagement. So it's a very important strategic process, I understand, and you described the methodology well, but I lacked on the slides and in the words, except Maria, the citizens. Mm-hmm. So how do you plan to engage with them? Because I think this is sometimes missing.
Maybe Henk?
Thank you for your question, Claudia. I mentioned the stakeholder participation process, and if we are talking about stakeholders, it's a broad set. Experts are also stakeholders for us. They have the knowledge that they want to bring to the table. They have an interest. Also, patient groups, interest groups are all stakeholders, but also civilians. What we do at RIVM, we include, now we have panels of civilians actually reflecting on the things that we're doing. Is it understandable enough, what we're doing? Also, what we did is also trying to find out what is, in the perception of civilians, actually the main threat for the future. Not that's guiding us completely that we are going to take that, but that is giving us a perspective of the civilians as well. So for us, it's part of the stakeholder participation process. Thank you.
Yeah, I think, yeah, exactly, Marco. I was coming to you because you mentioned the stakeholder engagement as well, please.
Yes, thank you. No, thank you for the question. You raised a really important point, and I totally agree with you. I mean, for us, it's really important to reach out first to the youth, because it's the youth who will live in this world that we are imagining, and then it was really also important for us to reach out to at least community leaders and faith leaders, because they are the trusted authorities at the local level, and it's really important to engage with them to get the perspective of these local communities, and then make sure that our public health recommendations are also relayed at the community level. Thank you.
Thank you so much. Please state your...
Stefan Tomek, I have two hats on. The one is an accredited journalist, expert journalist for the theme of prevention, health, and etc. The second hat is I'm still in the managing board of an organization founded about 20 years ago, the Eco-Wellness Group, who developed systems and standards for systemic health prevention for companies. And my opinion is, as Ilona Kickbusch said at the session where our Minister Rauch was also and did a summary, our society is ill, not only the health system. So I think we have to have a different strategy because we have to think what is the priority. So in all crises, in my age, and I had a lot of highs and lows in my life, starting with Chernobyl when I was a young manager of a company here. I think in a crisis, the most important thing is to set priorities. So we have been invited 2020 to the in Davos from the UNESCO to present our opinion about the pandemic obesity, especially childhood obesity. So obesity is one of the big themes in public health. You know better than me about the details and what is wrong with this system of nutrition and farming and all this, etc., around as a base of public health. So nutrition is the key. That's clear, meanwhile, about the microbiome and everything what we know. So my proposal is, as an, let's say, wise old man, perhaps, who's seen a lot, change priorities. Forget about the 16 goals. All partners in business, we need a new public-private partnership of the economy and the politics to change the system into systemic prevention. All the doctors I know, 80%, have no idea about public health, have no idea about prevention. They don't even know about the microbiome and all the modern things about nutrition, about you know what I mean. So we need a new change, a principal change of priorities and forming all efforts of economy, not I don't think with Pfizer or other big companies like this, but with new capital for a new strategic goal to change society through change of health systems.
Yeah, thank you so much. I think we all agree prevention is important, and actually prevention is a large part of the 17 SDGs. And by the way, the 17 SDGs are already priorities. So there is a prioritization already ongoing. I have two more requests for the floor, and I would like you to be very brief because we're running really out of time now, despite my efforts. Yes, you're
okay. Kajsa Wilhelmsson, Oxford Health Policy Forum. I'd like to then just shortly ask, because you talk about involving the unexpected stakeholders, maybe, the ones that actually are not necessarily the same as always goes to these meetings in the echo chamber of people that are expert in therapies and how to organize. And I think Kickbusch opened up the diplomacy discussion about the importance that what does it actually mean when we are embedding ourselves across all other policies. But the question would be also, are we really embedding all policies, all other experts into our thinking? I have the last 6 months looked into what it means that this is now a really substantial part of an economy, and what happens when you are a really substantial part of an economy. The criminals start targeting, not only with fake medicines, but by going into fake patients, fake sort of recipes, etc. So how do you talk, and how much have you engaged with those that are truly not therapy area experts in your strategic foresight? Or are we still like really limited in our view? That would be my question.
Thank you. Keep your answers for the moment, because I asked Lieven, you had a question. No, sorry. It was Lieven behind first. Sorry, and then I have to close. I'm really sorry.
Apologies to Caroline, and I will be very quick. But I wanted to share an analogy or an example with to economics. Which is also very interesting. You all know we had a major crisis in 2008. There was a paper written by a Dutch economist who analyzed what economists actually predicted the 2008 crisis. And he identified 12 economists, only 12, over the entire globe who actually could predict this. And then you would imagine that all policymakers would start studying these 12 economists, applying their models, questioning their own models, etc., etc. But nothing of all this happened. It's still a science that's remained the same as in the pre-2008 period. So this, I think, to make the point that we have to be very realistic about the openness and the willingness of policymakers to look towards the future and to look into the eye.
Yeah, and to look to a future that is beyond their elected mandate. Who wants to, on the range of stakeholders, very briefly?
Yeah, I can. I fully agree. That is challenging to organize the critical thinkers in a way that you're going beyond the usual suspects. We have as well, if we organize workshops, people are coming there because they understand a little bit more what we want, what our RVM is. But the critical thinkers, or the people who are really thinking differently, they are very difficult to reach out to. And yeah, we're trying, but we're not too successful in that.
Okay, Maria, quickly.
I actually wanted to answer a few things in the sequence.
Please, very short.
In a quick thing about priorities, and because it will be a roles and responsibility in communities. We're undergoing this exercise, as I spoke about, the strategic planning cycle. And it's this resource allocation ethical framework of how do we define priorities for an organization like MSF. But I think what's important here is in the system, we're part of a system. And that's the thinking we need to look at. What are our roles and responsibilities in our individual defined identity and priority within that, because in that complementarity of that. And that leads me to the community. And this is how we're starting to look in our community and patient-centered or person-centered approaches in how we design our projects. They're a part of the code, they're co-designers of our project, for patient perspectives and part of the committee to an iterative process of design, and being comfortable with that as patients and communities as partners in building this kind of trust between each other. And finally, I think we need to look at it from a system approach. And this is from MSF, at least parts of us are looking at it from the planetary health perspective of how we look at the broken human systems and how do we make that fit within a healthier relationship between the natural ecosystem. And I just want to end there.
Thank you so much. Yeah, very short.
Yeah, I'll be very brief. Like I said, foresight is an ongoing process, and in the early phases of this, we now have already identified a few stakeholders that we usually don't talk to, that we probably should talk to. So normally we have the One Health actors we talk to, but for example, we don't really talk to political scientists. We don't really talk to people with AI expertise, for example, or developers. So it is actually helping us to identify which other groups we have to talk to. So it's been already successful for us a little bit in that sense.
Okay, thank you. Margot, any additional comment?
I was just very quickly maybe mentioning that, yes, this is really an ongoing process, and we try to engage as broadly as possible. And as WHO, we have the EPWIN platform, where we have weekly webinars and where we try to reach out to communities so that we can also co-create our recommendation and co-build our future together.
Yeah, thank you. Thank you so much for being here this afternoon. We were here to answer the question, what should we prepare for? We don't have a crystal ball, but we do have tools, and we should see foresight as a tool. It is not a solution. And if we don't do anything with the outcomes of this tool, we will be in the same old situation that we have been. So I think that has been made very clear. We have to think outside the box, think unthinkable futures, and then see what is plausible and what is preferable, because this is what we should work towards to. But it's also very clear that we will make no progress if we don't even learn from what we have experienced. And that's also a lesson, that we don't learn the lessons. I think that was very clear in the past 3 years. And the last thing is that unless we find the willingness of politicians to invest in things that go far beyond their elective mandate, I think it will also will be also very difficult. But I think we should not get discouraged here. We should, for the sake of the generations after us, they will ask us, what did you do? We knew what we should do, and I think we should do what we can in order to prevent the worst if possible. So thank you very much for being here. I would like to thank a lot of people. First, our speakers for taking the time to come here. The younger Steiners who were really helpful for us and supported us with enthusiasm and dedication. The Gastein team to set up the whole technology behind the group sessions, and my own team, Daniel Schotte, Herjon Iking, and Catherine Edwards, for carrying my idea to do a foresight session here to such an outcome. Thank you so much, and have a very nice evening.